All right. Hello, everyone. Thank you so much for having me here today. First, I want to thank you all for being here, but thank you to those of you who completed the 2024 PBC patient survey. Whether you're newly diagnosed with PBC or you've lived with it for many years, your voices have informed this project. And we're going to be talking about the numbers, but we're also going to be talking about your real life experiences. So what are the challenges, what are the strengths, and what are your hopes for the future in PBC? So for the survey, we had 377 people complete the entire survey of the 414 who started it. The majority of people were from Canada, but we did have responses from across the US, as well as a couple in Ireland and the Netherlands. Most participants identified as women, and they also identified as being white or of European descent. This somewhat mimics what we see in the PBC literature, but it's also an important opportunity for us to have more purposeful recruitment to identify and get responses from people from other demographic groups as well. The majority of people were in the 61 to 75-year age group, and just less than half of people were retired, although an important number of people were still working full-time or on disability. And this just highlights how PBC can affect life at different stages. When we talk about diagnosis, so the average age of diagnosis was 51 years, and most people were diagnosed within the last 7 years, so 2016 to 2022 inclusive. And for medications, the most common medication was urso, or ursodeoxycholic acid. However, other treatments included Ocaliva and fibrates. And importantly, 72% of people felt that their treatment was helping to manage their PBC, but that leaves over a quarter of people who felt that it either was poorly managed or not at all managing their PBC. So now, what are people living with day to day? So the top 5 symptoms people reported experiencing were fatigue, itch, brain fog, dry eyes and mouth, and joint pain. And these symptoms were persistent regardless of what their lab values said. Many people talked about this disconnect between how their lab values were on their reports versus how they were actually feeling. One participant said, I feel my lab values are excellent. Why am I so exhausted? Or why can't I concentrate? And so we delved a little bit deeper into some separate symptoms. So we looked at fatigue, we looked at brain fog, and then we looked at itch. So looking at fatigue, you can see most people felt that it was being moderately managed, but a similar number of people either felt it was poorly or not at all managed. Then looking at brain fog, you can see similarly people felt it was moderately managed, but a larger number than fatigue felt that their brain fog was being not at all managed. And then looking at itch, which can be a very annoying symptom in PBC, you can see that more people felt that it was well managed or moderately managed, but there's still quite a number of people who felt this was a poorly managed or not at all managed symptom. So you can see that people want the symptom relief that they can feel. They don't just want lab values and improvements in numbers. So this really drives the importance of symptom-focused care. So PBC doesn't occur in isolation. So 81% of people reported living with at least one other chronic health condition. These were most commonly osteoporosis, digestive disease, thyroid disease, anxiety and depression, and Sjogren's syndrome. And just under 100 people reported living with at least 2 other chronic health conditions, and several people lived with even 4, 5, or 6 other chronic health conditions. And this just adds to the medical complexity of these patients and the symptom management that comes with that, and just reinforces the need for multidisciplinary care. So how did people navigate daily life with social and work responsibilities? So a third of people reported canceling work or social events within the past year. Another third reported needing help with daily tasks like cleaning and getting groceries. And many people talked about not wanting to disclose their diagnosis to friends or in the workplace. And a lot of people spoke about the invisibility of the illness, how these brain fog and fatigue symptoms aren't something that people can see when you're looking at them. So it's really hard to explain that or live with these on a daily basis. So what do you want? So you told us clearly you would like more options for symptom control. You would like fewer pills with fewer side effects. And most importantly, you'd like to see some treatments for itch, for fatigue, and for brain fog. And I think the richest part of this survey came with the open text responses that we received. So we have some quotes here. You can see someone's talking about the fatigue and how it feels like walking through cement, and how the social exhaustion that comes with it makes it really hard to connect with other people. Other people talked about the invisibility of the illness and how outside of the PBC community, it's really hard to explain that experience to other people. But there were also stories of resilience. So people talked about learning to live life to the best of their ability, taking the rest when they need, and then trying not to completely identify with their illness. And then people also shared stories of hope. So they talked about itch and fatigue being overwhelming at the beginning, but over time, these have become more manageable symptoms and they're able to live a normal life with PBC. So what we see here is that PBC isn't just one journey for one person, it's different for everyone. And so what would you like to add to help us tell us what it's like to live with PBC? So there should be a poll feature. It can just be one word, something like frustration, hope, resilience, anything that you feel maybe wasn't represented in the slides already. And I'll just give you all a minute to kind of share a word to describe what it's like to live with PBC. The fog, the brain fog, yeah. Advocate. Exhausting, the big one. Hope. So two sides of a coin there, yeah. Exhausting, hopeful, discouraging. Okay, I think we'll close it there. Thank you. So I think what we're seeing is that although there are these shared experiences or these different experiences living with PBC, you all share similar stories, whether that's challenges or whether that's strength, that can unite us all. And before I move into the priorities and what we hope for in the future, we just want to give a shout out to our clinicians. So a majority of people who responded to the survey were being seen by a gastroenterologist or a hepatologist, and many people spent a lot of time talking about the impact of their clinicians in the written text summaries, such as this quote here, which says, "I'm so thankful to my GP and PBC specialists. They did everything required to get me diagnosed, get me on treatment, and continue to monitor me." So thank you to the clinicians in the room and the researchers who continue to make an impact in the lives of people living with PBC. Just got one more slide, Shauna. So where do we go from here? So we think there's kind of three major priorities coming out of this survey. Number one is keeping and continuing to listen to patient voices. So surveys like this one can help us integrate that patient voice into care, into policy, into further research. Second, we need to strengthen access to specialist care and to multidisciplinary care. And then third, we need to promote research into symptom relief, especially around that brain fog, the fatigue, and the itch, and then overall interventions to try to improve quality of life. So thank you all for being here, and a special thanks to those of you who completed the survey and for your honesty and your courage. And we are excited to see what the future holds for PBC. Thank you.